starting us off is going to be Dr. Komal Bajaj from one of the nation's largest municipal health systems. Dr. Bajaj, thanks so much for joining us today. We're all looking forward to your 10-15-minute presentation around the innovations that advance breast health, which is going to be really appropriate to kick us off today. But Komal, over to you.
Thanks so much, Jerry, and a really hearty hello to the HITLAB community. It's great to be with all of you. Jerry, I just want to confirm that you can see my screen.
Not yet, Komal. You might want to try resharing it again.
No problem. We'll go ahead and do that again. Jerry, as you mentioned, it is Breast Cancer Awareness Month, the month of October, which in a lot of places across the globe generate a lot of important conversations around breast health. How about now, Jerry?
Yeah, we can see your screen just great.
Great. And so my perspective on thinking about technology innovations that advance breast health really come from my experience as a professor of OBGYN and a chief quality officer who's really thinking about high quality, planet friendly care. And so, we hear numbers, and it's important to acknowledge that numbers tell a story. And so I want to share some numbers with you. And these numbers primarily come from the United States, but are really sort of broadly applicable in a variety of settings. The first is that 1 in 8 women will develop breast cancer in their lifetime, 13% of the population. And that's really shocking, right? There are many, many people on this call today. Certainly someone in your lives will be affected by this condition, unfortunately. A recent study in The Lancet suggested that 2 of 8 are preventable through education and risk factor mitigation. Let's not forget the men in the audience. 1 in 700-ish will develop breast cancer in their lifetime. I think this is a number and a condition that really hasn't been discussed as much as it should be, certainly as it relates to men's health. 85% of women who are diagnosed with breast cancer have no family history. And I think it's really important as people are thinking about solutions to address breast cancer or breast health, they really think about that the vast majority have no family history. 50% of new diagnoses are in women 62 years or younger, and 9% are under age 45. Acknowledging the important role that structural racism and injustice unfortunately play in healthcare, Black women have the lowest 5-year relative breast cancer survival rate. I strongly believe that technology can help close the gap. And so just as a reminder, as of April of 2024, the U.S. Preventative Services Task Force suggested that for all average risk women, screening should occur every other year, starting at age 40 and continuing through age 74. This is a change from recommendations in the past where screening was, depending on risk factors, suggested at around age 40, but really started at age 50. So recognizing, that early screening, early intervention saves lives. These are new recommendations. So I want to tell you a story about Deirdre. Deirdre is a fictitious patient, but really represents an amalgam of patients that I've seen over the years. So Deirdre is 47 years old, came in for a routine checkup, and talking about her health, because of the pandemic, hadn't come in for a few years. And we started talking about breast health and talking about the recommendation to have a mammogram. And what she said was, well, you know what, I'm young, I don't have a family history, and I was talking with one of my friends, and when you're young, the screening isn't as effective, and so I just don't think it's for me. And so we really got to sort of chatting about this. And I said, that friend that you've been talking to, would you be comfortable getting them on the phone? And so we could talk about this together. I said, absolutely. That's one of my best friends. I'd be happy to talk about this. So we got on the phone and we started talking about, the numbers that I shared with you, the fact that, diet and exercise, a healthy weight can help contribute to breast health. And she and her friend both realized that, wow, getting a mammogram can save my life. And just because I don't have a family history, or because I'm young, it doesn't mean that I'm not at risk. And so this, really typifies the importance of solutions that are patient-centered, easily accessible, and trustworthy. So I'd like to spotlight a few areas of real sort of promise, some with really significant impact that we're seeing already as it relates to breast health. And then I want to share a little bit about just my thoughts on some areas that I'd like to see innovation in the future. So the first is this concept of personalized care to mitigate risks. And I want to spotlight, amongst other things, genetic testing and wearables. Certainly, as our ability to perform sequencing and more comprehensively analyze what the results are, we're able to identify high-risk individuals, guiding preventative and screening strategies. This has really come a long way in the last, certainly, decade, and even in the last few years. Wearables allow us to really, work with patients where they're at as it relates to mitigating factors for breast cancer risk, and patient empowerment through digital health tools, right? Self-management of modifiable risk factors, starting to see a lot of really great solutions that help promote, healthy breast health. As it relates to screening and diagnosis, before it was, well, let's take a family history, let's, talk about your risk factors, but really now being able to incorporate disparate sources of data, whether it's genetic data, lifestyle, where someone lives, allows for more tailored screening. And certainly we've seen a lot of uptake in solutions that promote better imaging, right? Algorithms that really improve accuracy and reduce false positives, addressing things like dense breasts. And so, I really look at this as an area of promise. The challenge with that is that people have to get to the mammography, right? And so there's a whole host of sort of opportunity in building trust to so that people get to mammography. As it relates to access, speaking of getting somewhere, right? Telehealth consults allow for sort of more widespread access, right? Really locally and across the globe. Liquid biopsies or blood-based testing for circulating cell-free DNA enables early detection and monitoring of cancer recurrence. I also am really heartened to see some of the wonderful solutions related to linking patients to trials, right? It used to be where individuals would have to, Google search, look at different databases on their own to try to figure out, how to sort of link to trials. And certainly some of the solutions that are out there really help make this a lot easier. I really like the idea of, patient centeredness and patient empowerment, and, self-exam apps, augmented reality training really help bring to life, the importance and also, how to perform these self-exams thoroughly. And certainly, the comfort of being able to do this in your, in your own environment is really, really heartening to see. And the last that I think is, really interesting to think about is precision medicine and communication. This idea of taking, all the tools that we have to discover new treatment areas and tailor treatments for specific cancer types. Also the ability to answer questions at any time. Certainly chatbots and AI assistants are able to do this in a variety of applications, including related to breast health. And then certainly, in working with public health colleagues, the ability, again, to link lots of different sources of data can help, further hone a strategy for breast cancer education and screening. So, some of the innovations that, I'm not saying there's nothing that exists that does this, but some of the innovations that I'll be looking for really as, a chief quality officer and women's health professional are solutions that promote trust. So solutions that, are easy to navigate, have, broad representation in the images and ways and modalities in which they are presenting information, I think is really important. Because remember, we have to sort of have people come for screening. And there's a lot of sort of steps and layers before that happens. As we move forward, we have more real personalized therapies, solutions that navigate beyond the initial diagnosis, right? There's a lot about what breast cancer is, the treatments, what are the stages, what are the, sort of general approaches that are out there, but something that really is tailored. I think there's some opportunities there. I like the idea of collectively engaging patients and caregivers. We've done a lot in our health system, to really think about a collective unit. And so, solutions that allow individuals to engage in care together in whatever way seems right for them is really useful. And certainly, the diagnostic journey for people can often be very challenging. And yet people are having different tests for different things all the time. And so, mammography is clearly a very important, way of screening individuals. But how can alternate imaging modalities be used? For example, if someone's having a chest CT for something else, or another kind of test, how can we begin to sort of merge those worlds so that if someone is having something for someone else, that we're able to ascertain this information at the same time? And I really hope that there comes a time where we don't need Breast Cancer Awareness Month, right? Because we've made so much progress in awareness, understanding, screening, and treatment that it just becomes the fabric of what we do, right? But when it comes to really thinking about breast health, it's going to take all of us. And I feel, very confident that some of the technology solutions that are out there and are being developed will hopefully make that a reality. And so look forward to keeping the conversation going. A very happy, Breast Cancer Awareness Month to all of you. Happy to connect on LinkedIn. There are so many perspectives on this call, and there's a lot that we can do together. Back to you, Jerry.
No, that's wonderful, Komal. Thanks so much for coming on the program. It's always a delight to have you on and share your insights with the group. So we really appreciate it, and hopefully see you soon back on the program again.
Thanks, Jerry.